The most complicated deformities are with destroyed joints. And nothing better to demonstrate that than a Charcot case. The gentleman is 70 years old, and you can see very clearly on x-ray something is not right here. You can see the abduction of the foot, you can see the rocker bottom foot deformity, and you can see that the ankle joint's okay. This hindfoot on the x-ray looks like it's arthritic. Wow, this hindfoot looks terrible. Is this a hindfoot that needs to be fused? So the weight-bearing scan really makes a difference here. And so here we're looking at the hindfoot, and you can see, but oh no, it's not so bad. That whole subtalar joint is actually fine. So it looks bad because the shoulder of the talus is deep inside Gossain's angle. And there's a little cyst there, but we go back here and we could see that the whole hindfoot is actually open. So this patient's collapse is really through the midfoot, and it's a lot of destroyed midfoot, but no destroyed hindfoot. So, and you could, look at all the images and help plan this out very nicely, very easily. So this surgery, obviously complex. You could see here the abduction is dramatically reduced, that he's now connected here. He still has some abduction, but I left all his hindfoot joints. So we don't have any of that extra stiffness, which means that his ankle and his hindfoot has not gone on to have arthritic Charcot collapse. And so that's, for this patient, meant that they are able to walk and function pretty much without impediment. So this guy, because we didn't fuse his hindfoot, his ankle's totally fine. He could still have balance. He could get up and down the stairs. He could walk. He gets around with regular shoes. He doesn't need an AFO brace. He doesn't need extra wheelchairs, extra walkers, extra hospitalizations. He doesn't need extra surgeries. I mean, he's a functional member of society. And had we overfused him, most likely we would see the effects of having that stiffness, worse balance, more falls, potential for Charcot at the ankle, and more disability, meaning people would have to help this person with their activities of daily living. If I didn't have the weight-bearing CT, I would get an MRI and look at that hindfoot joint complex. It wouldn't necessarily tell me like the whole story because it's not weight-bearing. And the CAT scan would also be good, but not as good because it doesn't show you, again, the weight-bearing effects. Like you might see that subtalar joint's open, but is it really open if the patient was weight-bearing? So you don't have a real conclusive exam with a regular CAT scan.